Good evening, Americans. Welcome to The Ed Show tonight. Guess what? Nothing's changed for the bad guys. Mitch McConnell says health care reform is dead. Jim DeMint is talking about Waterloo again. Let me be very clear, crystal clear, to the viewers of this show and to the listeners of my radio talk show. We're not going to do a head count on a cable talk show and pass legislation. But what we are going to do is make sure that the Democrats know if they side with the guys that are the bad guys on this against the people in conference committee, there's going to be hell to pay at the polls. If this is about reform, if this is about change, liberals, we've got to stay focused. The bipartisan, moderate, slap-in-the-face liberal Baucus bill has netted how many Republicans? Zero. We're still stuck on zero. Remember that. The Finance Committee put up a bill that comes, okay, well under the $900 billion, and I know we're all wiping our pockets out, really happy for that. Look, it doesn't create a national insurance plan, doesn't cover everybody. It includes tax incentives for businesses, and the GOP still says no.
There are those who consider this a zero-sum game and will only declare victory if President Obama concedes defeat. It's telling that one of their most oft-repeated arguments protests not the content of the bill, but now, Mr. President, the number of the pages of the bill. How's that for criticism? The bill has too many pages.
Senator Baucus said, I have to try everything I can to make this a bipartisan effort. And he did. He spent months at it, day after day after day. And what does he have to show for it? At the end of it, two of the Republican senators walked out saying, we're not interested. And the other said, I'll wait and see.
Now, just remember, we've compromised, no single payer, and now there's this talk of a deal about a compromise on co-op. I'll get to that in just a minute. Just remember, the Republicans are nowhere to be found when it comes to reform. They're protecting big business and the insurance companies. But despite the huge majorities in the House and the Senate, the Democrats seem to just can't find the will to get this thing together. The Baucus bill isn't a full wallet. It is loose change, folks. It's a hoodwink. There are some good things in it. I'll grant you that. Getting rid of the pre-existing conditions, limiting premium prices, yet I got to see more fine print on that. Taxing so-called Cadillac plans for the rich. Well, somebody's got to pay for this stuff. But the Baucus bill only covers 94% of the people. It leaves 25 million people uninsured. Now, hold it right there. This means that 25 million people are still going to be storming emergency rooms looking for coverage. And where do you think costs are going to go? You got to stay focused. We have got to get everybody covered. They're going to be a drag on the system. Now, as we've been told by Wendell Potter, this is nothing but a big gift to the insurance industry. Hey, here's a bunch more customers. And guess what? Uncle Sam's going to be paying for them. The government is paying you to pay private insurance companies. That's supposed to be a deal. They're not looking for any change here. This isn't reform. This is a sellout. The House is floating an interesting area to fix a lot of stuff. Now, Nancy Pelosi, House Speaker, said Democrats are looking for a windfall profits tax on insurance companies. That'll make them nervous.
I have asked Chairman Rangel to ask his staff to see what is in it for us in terms of a windfall profit tax on income on the insurance companies. There was more that the insurance companies could contribute to this health care reform, because after all, they're going to get 50 million new consumers, many of them subsidized by the taxpayer, and we think they can put more on the table.
Thank you for the counterpunch, Nancy Pelosi. That's how you play with these righties. Come back at them, say, look, you want to compromise on public option? Okay, this is what we're going to do, the insurance industry. This is how it's supposed to be played. Now, there were also a couple of developments in the Senate today. Barack Obama called Olympia Snowe. I guess they're getting along just fine. She confirmed that they talked about the trigger, all right, but did not disclose the full details of the conversation. Also, the public option compromise, which was first reported on the show by Huffington Post reporter Sam Stein last night that would create a national plan but allow states to opt out. Joining that plan apparently has support of a couple of Democrats on opposite ends of the spectrum, both Chuck Schumer, a strong supporter of the public option, and Max Baucus. They are actively considering the idea. And late today, you know what? Hold on. I never thought I'd be left of Howard Dean, but I guess I am. Howard Dean, a doctor whose opinion carries a lot of weight with lefties, through his support behind this state opt-in, opt-out gig, Dean says it's real public plan, it's real reform, and if the opt-out proposal were to get 60 votes in the Senate, Democrats ought to support it. Hold the phone on that. Am I the last rat to leave the ship? What the hell's going on? The Republicans are getting everything they want for the insurance industry. And I will tell you what, this isn't over. Lefties, we got to email, we got to call, we got to stay focused, we got to be on this. No cable talk show is going to talk somebody into a vote. I understand that. But I do believe that there are Americans out there that want this, that can be motivated to force these folks that when they get into conference committee, they'll remember it's about the people and it's not about the insurance industry. Get out your cell phones. I want to know what you think about this. Are Democrats, are they at a point where they're just going to take anything when it comes to a health care bill? Text A for yes and B for no to 622-639. We'll bring you the results later on in the program. All right, lots flying around on Capitol Hill today. Joining me now is Senator Jeff Bingaman of New Mexico. He's a member of both the Senate Finance Committee, Gang of Six, and also on the Senate Help Committee. Senator, at this hour, you are the perfect interview, and I appreciate your time tonight because we have to mesh these two things, and you have been right at the firewall with all of this. Now, where do we stand on the state opt-in, opt-out program? Is this something that you could support, and if you could, why?
Well, frankly, Ed, we just went through a couple of weeks of markup on the bill. There was ample opportunity for that to be put forward as an amendment. I never did see an amendment offered involving that concept. My initial reaction to it is that states have the authority right now, if they want to establish a so-called public option within their state. There's no prohibition against that in federal law. There's nothing to keep them from doing that. So I guess the idea of having a state opt-in to a national public option might be that the federal government would provide assistance to states that wanted to do it, but I'm not sure that that's what's being thought about. So I'm sort of agnostic until I learn more about the proposal.
Okay, so this is pretty much an 11th hour curveball, just trying to get some people satisfied with a government plan that might be involved and provide competition. Is that correct?
Well, I don't want to characterize it as a curveball. It may be something that merits serious consideration. As I say, though, we had a chance to offer the public option. Senator Rockefeller offered one version, which I supported. Senator Schumer offered another version, which I thought was even a better proposal. I supported that. There wasn't anything offered involving any opt-in or opt-out opportunity for states.
See, this is a late-inning twist is what it is, and I think it's part of a stall tactic and a diversion, but that's just my opinion. Now, to the point, Senator, the Senate Finance Committee bill, as it stands at this hour, do you think it can get 60 votes?
Well, I'm not sure whether it can. I certainly hope it can, but we're not going to get to vote on the Finance Committee bill.
Not until Tuesday, yeah.
No, well, we vote on it in committee on Tuesday, but the full Senate is never going to vote on it. The full Senate is going to vote on the merged bill that Senator Reid develops from the Finance bill and the Help Committee bill.
And you're on both of those committees, and in the Senate Help bill, it's got a public option. And your colleague Sherrod Brown has circulated a letter stating what senators are for a public option. Only 30 of them have signed it, and your name's not on it. Why not?
Well, frankly, I'm not in the practice of writing letters to Senator Reid. I see him about every hour and a half, and when I have things to say to him, I say them to him, and he says things to me. And,
so what did you say to him about a public option? Are you for it or against it? Would you go along?
Frankly, he hadn't asked my opinion as yet. I voted for it in the Help Committee. I voted for it in the Finance Committee.
Okay.
I'll vote for it if the opportunity presents itself on the Senate floor, which I believe it will. And I don't know if he'll put it in a bill that he brings to the Senate floor or if it'll be proposed as an amendment on the Senate floor. But either way, I would plan to support it.
Okay, Senator, well, I would count that as a signature. Just because your name's not on here, we got a commitment that you're for a public option, which I think speaks volumes, and I appreciate your time.
Good talking to you.
You bet. Senator Jeff Bingaman from New Mexico with us here on the Ed Show tonight.